Hello everyone, welcome back to the channel. Today we are going to talk about a topic that is absolutely essential for every physiotherapy student and professional. That is pharmacology in physiotherapy. Now many physiotherapists, they think that since they focus on exercise, mobilization, rehabilitation and electrotherapy, they don't really need to study pharmacology in depth. But here is the truth. Pharmacology plays a direct role in patient recovery, rehabilitation planning and even patient safety. By the end of this video, you will know exactly why pharmacology is important in physiotherapy, what role it plays in clinical decision making, and the major drug groups that you must be familiar with as a physiotherapist. So stay tuned till the end. The book that I'll recommend for all the physiotherapy students who are studying in second year BPT and even MPT students is this Pharmacology for Physiotherapy, 4th edition by Padmaja Uday Kumar. This is a very small book, only 270 pages, and in this book, it is basically covering all the topics, all the content which is related to pharmacology in a very short, concise manner, and plus it is also focusing more on the topics which are important from physiotherapy point of view. So this is the book that you should follow for physiotherapy, for the physiotherapy students who are studying pharmacology in second year of BPT. Why pharmacology is important in physiotherapy? Let's see that one by one. The first part is patient safety and drug interactions. Now, many patients who are undergoing physiotherapy, they are already on multiple medications. For example, antihypertensives, antidiuretics, anticoagulants, painkillers, or steroids. So as a physiotherapist, you need to know how these drugs may affect the exercise tolerance, bleeding risk, healing time, or muscle strength. For example, a patient on anticoagulant like warfarin may develop bruising with even minor injuries during therapy. If you don't recognize this, then it can become dangerous. The second point is optimizing rehabilitation outcomes. Now, the drugs, these influence patient energy, alertness, and performance. For example, you give beta blockers to a patient, and beta blockers reduce the heart rate in response to exercise. So, physiotherapist must adjust the exercise intensity accordingly. Or another example, muscle relaxant or sedatives, they may reduce the coordination. So, in that case, the physiotherapist must plan safer exercises. The third point is understanding pain management. Now, physiotherapists often deal with pain patients like patients suffering from musculoskeletal or post-surgical or chronic. So knowing how analgesics like NSAIDs or opioids or adjuvants like gabapentin, they work, that helps you decide in the right timing for the therapy. For example, scheduling a therapy after analgesic peak effect ensures better patient compliance and mobility. Fourth point is holistic patient care. Pharmacology knowledge improves communication with the doctors, nurses, and the multidisciplinary team. Now you become a more reliable healthcare professional when you can say that this patient's steroids may be delaying the wound healing, or this patient is drowsy due to the opioids, so let's modify the therapy. So these are important points which help you in becoming a good physiotherapist. The knowledge of pharmacology will help you. So that is why pharmacology is important in physiotherapy. So definitely it is important for a good professional credibility. Your patients will trust you more when you can explain why their medicines matter for the therapy. Then prevention of complications. When you recognize the side effects early, for example, patient may present with dizziness due to antihypertensives or a low BP, then you can prevent falls, right? Third thing, rehabilitation in special populations like geriatric population, the old patients are there. Now you know they are usually taking a lot of medicine, so polypharmacy is very common. Adverse drug reactions are very frequent. Then patients like neurological rehabilitation, patients of paraplegia or hemiplegia. Now drugs like anti-epileptics or antidepressants or antispastics, they will affect the therapy outcomes. Then patients who are having heart attack or heart failure, so cardiac rehab patients. In them, you must know what drugs they're taking, anti-anginals, anticoagulants, beta blockers. All these drugs have effect on the body exercise potential. Now let's take important drug groups one by one. The first drug group that is very important is analgesics and anti-inflammatory drugs. Now what comes in analgesics and anti-inflammatory drugs? Normally we have all the NSAIDs, that is non-steroidal anti-inflammatory drugs like ibuprofen, diclofenac. Then we have drugs like paracetamol also in the same group. Then we have opioids, which are also painkillers. Opioids where we have morphine, tramadol, lot of drugs are there. Then some GABAergic or GABA potentiating drugs are there like gabapentin, pregabalin. These are very effective in neurological pains, neuropathies. Apart from that, we also have corticosteroids which are given to some patients, as corticosteroids are very good anti-inflammatory drugs. So why a knowledge of NSAIDs and anti-inflammatory drugs is required? Because so that you can understand the complications, you are aware of the adverse drug reactions like GI bleeding can happen, or gastric acidity, you are getting a lot of exercises done and the patient can have GERD, that is gastric esophageal reflux. So plus like aspirin and all these drugs, they are sometimes used in low dose also for patients who are having a myocardial infarction, and they can result in bleeding. They can result in increased bleeding because they are anticoagulants, antiplatelet agents. So when you have that knowledge, then you can accordingly adjust the exercise schedule of the patient. and that will make you a better physiotherapist. The second group is muscle relaxant and antispastic drugs. Now these are very important drugs from physiotherapy point of view, because you will be working with a lot of students, children who are suffering from cerebral palsy or some kind of spastic disease. So their muscle relaxant antispastic drugs are a major drug group which is used. Now we have centrally acting drugs like baclofen, tizanidine, then we have peripheral drugs like dantrolene, botulinum toxin also is used for local spasticity. So knowing about them is important because they are used in neuro rehab, they're used in post-stroke patients, cerebral palsy, spinal cord injury, and they affect the tone, strength and mobility of the patient. The third group that is important is cardiovascular drugs. So in cardiovascular drugs, we have drugs like beta blockers, ACE inhibitors, anticoagulants, antiplatelets, diuretics. And why a knowledge of these drugs is important? Because you will be working with cardiac rehab patients, you will be giving them exercise prescriptions, fall risk management, bleeding precautions. These are the important points because of which you should know about these drugs. Then the fourth group is respiratory drugs. So in this we have bronchodilators, steroids, mucolytics. Now why these drugs are important? Because when you will be working with ICU patients, so in ICU patients a lot of secretions they get collected in the chest, and you have to do chest physiotherapy to remove those secretions, to remove those mucus plugs. So a knowledge about respiratory drugs is important for chest physiotherapy, for pulmonary rehab patients, for asthma, COPD patients. These are the drugs that directly affect the lung function and the exercise tolerance. The fifth group is endocrine and metabolic drugs. Now endocrine and metabolic drugs are important because you will be working with diabetics, you will be working with patients who are hypothyroid or hyperthyroid. So insulin, oral hypoglycemics, thyroid drugs, steroids, these are the drugs which are used. And like diabetic patients, they need exercise planning to prevent hypoglycemia. Steroids, they slow the healing, so you can see that the wound healing is deranged or reduced. So these drugs also affect the rehabilitation of the patient. Then the sixth category and the most important one is neurological and psychiatric drugs. These drugs, this group includes drugs like anti-epileptics, antidepressants, antipsychotics, Parkinson's. So you will be working with a lot of patients suffering from Parkinson's disease also, who are having tremor, rigidity and akinesia. So you need to know about these drugs because these drugs are going to affect the alertness, the motivation, the coordination, the mood, the muscle tone of the patient. So in the end, I'll say pharmacology is not just a subject you study for exams. It is a lifeline for safe and effective physiotherapy practice. If you understand how the drugs work, what their side effects are, and how they interact with the exercise, you can truly become a more effective physiotherapist. So whether you are in musculoskeletal rehab or neuro rehab or cardiac rehab or pulmonary rehab, your knowledge of pharmacology will help you to protect the patients, to improve the therapy outcomes, and it can earn professional respect in the healthcare team. So don't ignore pharmacology, embrace it. It is as important as anatomy, biomechanics, or exercise physiology in your journey as a physiotherapist. Thank you for watching. If you have found this helpful, please give it a thumbs up, share it with your classmates and colleagues, and don't forget to subscribe for more content on physiotherapy, medicine and healthcare. See you in the next video.